right, I'm going to go ahead and get started with everybody. Good morning. Welcome to the Wednesday, March 30th, Washington State Department of Health media briefing. I'm Rachel Sims, your facilitator for this event. I'd like to welcome our panel for today. From the Washington State Department of Health, we have Dr. Umair A. Shah, Secretary of Health, Lacey Fahrenbeck, Deputy Secretary for Prevention of Health, Dr. Bob Lutz, COVID-19 Medical Advisor, Michelle Roberts, Assistant Secretary for Prevention and Health, and Andrew Rose, Deputy Assistant Secretary of Response Operations. To begin today's briefing, we'll open with remarks from Secretary of Health, Umair Shah.
Thanks so much. Thank you for the kind introduction. Can you hear me okay? All right, I see some nods of heads, so thank you. I'm gonna start by just thanking Dr. Lutz, Lacey, Michelle, Andy for joining today and being part of this briefing. Just a couple of things before we get started. First of all, it's been a month since we've had a chance to meet with all of you, and I want to again underscore just the appreciation that we've had for our media partners and everything that you have continued to do throughout this pandemic to help us fight misinformation and also provide details of what's happening in the state. We thought it was important to be able to update you all on what's happening in the state of Washington, especially as you're seeing, just as we are, some increasing concerns related to COVID-19, certainly within our state, but also beyond our state across the country. But before I jump into COVID-19, I did want to just take a moment by acknowledging what occurred, the unspeakable tragedy in Uvalde, Texas yesterday. As you know, took the lives of 19 children, 2 adults, and we have another senseless mass shooting in our nation. As you know, I was in Texas for 25 years, and it really hits close to home. There have been so many of our team members in the public health community that have been impacted, and community members that have been impacted by the needless loss of life and the suffering that we have seen, to violence that obviously happened just recently in Buffalo, as well as what was occurring, as you know, across the country, including in Laguna, California. There have been multiple instances where we see violence that rears its ugly head, and we're hopeful that all those who have been impacted get comforted at this difficult time. But we also hope that people will take a call to how we can come together as a nation to really take on these tragedies in a policy-driven fashion. So I just wanted to start by saying that, in our hearts and prayers, again, go out to those who have been impacted by these recent events. You know, when we look at COVID-19, as you all have been watching as well, we've been seeing an increase in cases and hospitalizations in the state of Washington. This continues to be of concern to us. Obviously, we have talked about the fact that cases have likely represents an undercount of what we've been seeing, given the amount of COVID-19 testing that may be happening. As you can see on this curve here, the amount of COVID-19 testing that may be happening with at-home tests or other kinds of ways that people are being diagnosed or self-diagnosed with COVID-19, and yet at the same time also recognizing the absolute importance of keeping track of what's happening in this system. As you can see, and if you could put that graph back up, if you wouldn't mind. So since the last time we were giving a briefing, you can see that we had come off nicely from the Omicron curve, and we have started to see an increase that has really not gotten to the point of Omicron or our Delta wave previously, but it is concerning to us, especially as we talked about with the undercounting of cases. If we can go to the hospitalization graph, what I think it's also critical to say is that as we watch BA2 and monitor its movement across our state, our focus remains on watching for serious disease. And that remains absolutely concerned about healthcare capacity as measured by hospitalizations. And that's what we've started to see as an increase in our state as well. And so it's not just cases, it's hospitalizations are also increasing. And obviously of note is that we have not had an increase in deaths in the state of Washington thus far. And let's hope we continue to keep it that way. But it is so critical that we need to do in order to protect ourselves. And I think this is a key message from us. If you remember in the Walk Forward plan in March that we released, we made a number of commitments that we at the state were going to be doing behind the scenes, but we also have a partnership with our communities and making sure that they can do. As you know, the CDC recommendation is if high risk for severe illness, we want you to talk to your provider, whether the mask and take other the cases and the increases and transmission moving from medium to high in the Midwestern states
Dr.
as well.
Shaw,
So
we're
we're
audio from you.
keeping an eye on these.
Dr. Shaw, we're getting poor audio.
With our gene sequencing, including our water surveillance,
Pardon us, everyone. We seem to be having some audio challenges right now. We're waiting for this to resolve.
can you hear me?
There we go. Welcome back, Dr.
I am so sorry. Yeah, and I am not sure where we left off, but I was just making the comment that as we're seeing disease activity increase across the country, certainly disease activity as well as hospitalizations increase in our state, this is the time that we want to remind everybody of the recommendation that Department of Health has had, which is that when you are in indoor settings that are crowded, confined spaces, we absolutely want you to wear a mask, or at least make sure that you're doing everything you can to protect yourself or those around you. That also includes if you are for an extended period of time, where if you're in a place where it's a shared space. And then finally, most importantly, is also reminding everybody of the importance of masking when you yourself may be elderly or may have a comorbidity, a medical condition, whether you yourself or somebody in your household, this is the time for you to be wearing a well-fitted, appropriate mask to be able to protect yourself and those around you. In under 5 that Michelle Roberts is going to be providing information to, but this is the time for us to remind ourselves that this pandemic is not over. We can continue to do things like get boosted, make sure that we're getting tested, making sure that we're taking care of those around us, wearing a mask, especially when you're in, again, indoor confined, close spaces, when you have potentially medical conditions and or elderly or age reasons for it, and or if you're in a situation where it's poorly ventilated. This is the time for us to continue to take those precautions, those safety protocols. So I just wanted to start with that, and I'm going to turn it over to Lacey Fahrenbach to provide additional details. Then we'll go through a team of folks, and then we'll come back for additional.
Thanks, Dr. Shah. Good morning, everyone. Thank you for joining us today. As you heard Dr. Shah mention, disease is rising in most parts of our state, both hospitalizations and cases. And while we're grateful to not see an increase in deaths, we do want to help Washingtonians understand what you all can do to protect yourself and remain safe, as we go through this increase in disease. We are not returning to any broad mask requirement at this time, but we are strongly recommending that masks be worn in crowded or confined indoor spaces, or in areas where there may be poor ventilation or air quality. Masks continue to be required in some settings. Those settings include healthcare, long-term care settings, and correctional facilities. That has not changed. When you are out and about, if you're wearing a mask, we do recommend that you consider a high quality, well-fitting mask, a mask like a KN95 or a KF94, or an N95 if you have those available to you. Also a reminder that local health jurisdictions, governments, school districts, or businesses may still require masks. So it's important to know the local policies in place, and also important to look at your local community levels of disease. If you are in a setting where there are policies, please follow them. These are in place to protect you, the employees, or students in that environment. Even though masks are no longer required in many places, there are many individuals who will choose to wear a mask or may need to wear a mask for additional protection of COVID-19, against COVID-19, sorry. And that includes individuals who are immunocompromised, maybe those who live with someone who's immunocompromised, or people who have a family member or household member who is not yet vaccinated, and that could include young children who have not yet become eligible. There are also people who will simply feel safer wearing a mask, and each family and individual will have to make their own personal risk assessment around these issues. Factors that you can consider are the level of disease in your community. Are you going somewhere indoors or outdoors? If it's indoors, how good is the ventilation or air quality? How long are you going to be in that environment? How many people will be there? The more people that are there, the greater the risk. Do you know the vaccination status of the people that you're visiting or gathering with? And of course, as we've mentioned, do you have members of your household that are not yet vaccinated, are immunocompromised, or are at risk for severe COVID-19? I can share my own family example. When disease was low and requirements were relaxed in schools, we did give our children the choice to wear a mask or not in their school based on what we knew about that physical environment and the level of disease in our community and our family's health. Though now that disease is rising, we are asking our kids, our two children, to wear masks throughout the school day to protect themselves and to protect others. There are 4 tips that I want to remind you all about of staying safer with COVID rates increasing. So the first, most important, stay up to date on COVID-19 vaccines. If you are not yet vaccinated to protect yourself against COVID-19, talk to your primary care provider, get your questions and concerns answered, and get vaccinated. If you have your primary series and not yet your booster, get your booster. Vaccines are not perfect, but staying up to date on vaccines is the best way to prevent serious illness, hospitalization, and death among adults and children. So that is number one. Number two is optimize your respiratory status and environment. Well-fitting masks work. While not required, they are still recommended, as I noted. And then the second piece of this is to pay attention to the ventilation where you are and the air exchanges. In places like schools, restaurants, offices, any sort of building that you go into. If you're indoors, open windows if possible. And if you're gathering, go outside whenever possible. That will lower your risk. Number three is to be conscious of your distance. Think twice about being in very crowded environments. If you do have to go into a crowded environment, of course, be vaccinated, wear a mask, and watch your distance. 6 feet is the safer distance to aim for if you can. And the fourth is be prepared. Be prepared with tests and have a plan to access treatment if you are at risk for severe disease. We want you to have your tests on hand in your medicine cabinet, and you can get those through our Say Yes COVID Home Test portal, covidtest.gov. They're also widely available in pharmacies and through online retailers at this point. And there continue to be testing services through community-based test sites and pharmacies for those who need diagnostic tests. And then think about when you should test. If you're going to go to an event where you might expose others, or you're going to gather with someone who's at risk for severe disease, you'll have that test in your medicine kit. If you have symptoms, wake up, feel congested, or you've been exposed to COVID-19, that's a great time to test. Please isolate if you test positive, and as mentioned, have a plan to access treatment if you're at risk for severe disease. You're going to hear more about testing and antivirals from Dr. Lutz shortly. So with that, I will please just offer my sympathy and condolences to the families and children in Uvalde, Texas, as well as the communities in Buffalo and Laguna Woods. Gun violence is preventable. Your communities deserve safety. All of our communities deserve safety wherever we learn, work, play, and pray. So with that, back to you.
Thank you, Deputy Secretary Fehrenbach. Next, we'll go to COVID-19 Medical Advisor, Dr. Bob Lutz.
Well, good morning, everyone, and thank you. And Lacey, thank you for that sort of segue and introduction to looking at how we can prevent COVID, and if we get COVID, then how we can potentially treat it. So as Lacey said, those 4 tips are really key. And certainly, prevention is definitely a priority for everyone, but we also know that people are at times putting themselves into risky situations, be it by gatherings. And so that's where testing really becomes a priority for us. And so testing is something that we really want to encourage people to do. As Lacey just mentioned, think about it if you're out going to a gathering, if you've been at a gathering, think about it if you're traveling. Let's say potentially you're traveling, or maybe you've come back from travel, then consider testing, especially if potentially you've been in an environment that's high risk. If you're feeling unwell, certainly with testing being available right now, testing should be a consideration for you if you're just not feeling well, and especially if you've been in contact with someone that you believe could have had COVID or in a high risk setting, such as a gathering. As Lacey alluded to, we continue to have tests available. These over-the-counter tests are readily available through the state Say Yes to COVID test initiative. Right now, households can place up to 2 orders each month, and that's 10 free tests per month. Simply going online and to the website, sayyescovidhometest.org, or via the DOH COVID hotline. Prepare. Know that it may take 1 to 2 weeks for these tests to actually arrive, although many times they're arriving within 48 hours. But you want to be prepared in case you're putting yourselves in a situation where at risk for contracting COVID-19. If you do find yourself testing positive, as Dr. Shah alluded to, right now we're seeing increase in cases, but we also know that many of the individuals are testing at home. And so we're not having the ability to capture all of the data. So know that you can actually report these tests via the Say Yes COVID Test website. And it's important to know that as of May 22nd, through this initiative, Washington State DOH has provided more than 6.6 million tests to Washingtonians across the state. So again, a real credit to the work being done at the state, and again, to you as individuals looking for these tests to keep yourselves as well as your community members safe. I want to then pivot then to what happens if you contract COVID. So we know that COVID has caused severe disease. We also know, however, that we have medications now available that can actually treat and prevent severe disease, especially for those individuals who are at risk. So Paxlovid is an oral antiviral. It's been available for a number of months. There are some limitations to it in that it has to be prescribed by a provider and it has to be prescribed within 5 days of onset of symptoms. But it's very effective. The research has shown that it's almost 90% effective at preventing severe disease. So if you find yourself potentially contracting COVID, you find yourself also at one of the categories of potentially being high risk for severe disease, i.e. going to the hospital, requiring hospitalization, then again, I would encourage you to talk with your provider and see whether or not you're eligible for Paxlovid. It's a medication that, again, as I mentioned, very effective, but it has to be ideally provided within 5 days of onset of symptoms. Currently, there's plenty of Paxlovid across the state. We have more than 800 locations, be they pharmacies, be they clinics, where Paxlovid is available. And so it's really important for you to be aware of your treatment options if you get COVID. So with that, I'm going to turn it over back to Rachel. Thank you.
Thank you, Dr. Lutz. Next, we'll go to Assistant Secretary Michelle Roberts.
Well, good morning, everybody. I'm Michelle Roberts, and I lead the state's COVID-19 vaccine planning and distribution team. So as hospitalizations and cases rise in Washington, vaccines remain the best way to protect yourself and your family from severe disease, hospitalization, and even death from COVID-19. It's critical to stay up to date on your boosters and COVID vaccines and your boosters. The good news is that last week, the FDA and CDC expanded booster dose eligibility. So booster doses of the Pfizer BioNTech vaccine are now available for children age 5 to 11. Kids are eligible for a booster dose 5 months after their primary series. Immunocompromised children should get a booster after at least 3 months. We want to remind everyone that the idea of COVID-19 is always a mild disease in children is simply a myth. Since the beginning of the pandemic, next slide, more than 4.8 million children ages 5 to 11 have been diagnosed with COVID-19, with 15,000 hospitalized and tragically 180 deceased. It is critical to use the tools we have to protect our kids, to keep them doing the things that they love and being in school and in sports and activities, and COVID vaccines can help us do that. As far as we look ahead to this holiday weekend coming up for Memorial Day, graduations, and summer, it's important that everyone stay up to date on your vaccinations and boosters. Next slide. We've given out more than 13.8 million doses of COVID-19 vaccine to more than 5.8 million people. Next slide. And nearly 82% of people age 5 and up have received at least one dose. It's slightly out of order. I was looking for the mountain graphic. Do we have it still? But nearly 82% of people age 5 and older have received at least one dose, and more than 74% are fully vaccinated. So every day, more and more people are furthering protecting themselves by getting a booster shot. So next slide. We've given out more than 2.8 million booster doses, which means nearly 60% of the eligible population is up to date on their COVID-19 vaccines. So now I think I want to go back to those two slides that had the data by age. But unfortunately, Though we have about 60% of the population who's gotten a booster dose, there are really concerning gaps in booster dose coverage, leaving a lot of people at risk of severe disease. We're learning that protection from COVID vaccines does decrease over time, so the best protection is to stay up to date with COVID-19 vaccines, which means getting an additional booster dose when you're eligible. This slide shows our gaps by age. The darkest blue bar is the percentage of people who have gotten at least one additional dose of COVID vaccines when they become eligible. And you can see there are some significant gaps between the people who've completed their initial series of vaccines and then the people who are best protected by being boosted when you are eligible. Next slide. We also see these gaps by race and ethnicity, which is also greatly concerning. You can see for some of our populations, they have very high rates of their initial series of vaccines, but their booster dates are significant, their booster doses are significantly lower. We're working really hard with our community partners, continuing to work with community-based organizations to be trusted messengers about COVID-19, work with these communities to host caravan events and make sure they have information that's for their community to encourage both booster dose vaccination and keeping people up to date on booster doses. Next slide. Just want again, before we go through, but remind everybody about the recommended booster dose interval. So again, we recommend children age 5 to 11 should get a booster dose of the Pfizer vaccine after 5 months and 3 if they're immunocompromised. The booster dose schedules for everyone 12 and older, they should get a booster dose 5 months after completing their primary vaccination series of Pfizer or Moderna, or 2 months after receiving the single shot Johnson & Johnson vaccine. And everyone 50 and older should receive a second booster dose 4 months after receiving their first booster doses. Anybody age 12 and older who are moderately or severely immunocompromised should receive a second booster dose after 4 months after receiving their first booster dose. And those 18 and older who received a primary vaccine and booster doses of Johnson & Johnson 4 months ago can receive a second booster dose of an mRNA COVID-19 vaccine. I know that's a lot of information about booster doses with a lot of different intervals depending on your age, your health condition, if you've already completed your your primary series and are getting your first booster dose or your second booster dose. We have great information on our website at doh.wa.gov that can help you understand the intervals and figure out what you need to do to stay up to date on your COVID-19 vaccines. Just want to quickly mention that we still do not have a final timeline for approval of the vaccine for kids under age 5, 6 months through age 4. We know that families are waiting very anxiously to protect those children with the power of vaccines. And we should see some action on this in June and know a lot more. So the FDA is going to meet in June to review data on Pfizer and Moderna vaccines for infants and toddlers. Earlier this week, Pfizer said their 3-dose vaccine for kids 6 months to 5 years was 80% effective in preventing illness from the Omicron variant based on preliminary data for clinical trials. Moderna has also asked the FDA to authorize its 2-dose for vaccines for kids under 6. The FDA will be reviewing that data and making a decision around emergency use authorization. Then we will also hear from our federal partners at the Centers for Disease Control and Prevention, and finally our Western States Science Work Group to make sure before the vaccines start being given in our state. But we hope there's a pathway for families later in June. And in closing, so final slide, getting vaccinated and staying up to date on your vaccines continues to be the very best way to protect yourself and those around you from COVID-19. So to find vaccine locations near you, visit the state's vaccine locator website or vaccines.gov. We have people who can help make an appointment. So if you have questions or need that help making an appointment, please call our state's COVID-19 hotline at 833-VAX-HELP. Thank you.
Thank you, Assistant Secretary Roberts. And this brings us to the Q&A segment of today's briefing. We do have several media with questions today. If we're not able to get to your question, please reach out to us at doh-pio@doh.wa.gov. Our first question today comes from Kate Walters of KUOW. Kate.
Hi, yeah, thank you all for taking the time to update us. I have two questions, if you would indulge me, around boosters. First of all, just wanting to see if you could address, why we're still seeing the gaps in which communities are getting boosters. We've known for a while now that there were challenges with getting vaccines into certain communities. A lot of work was done, and wondering why those gaps still exist. And then my second question is just for folks who had their booster dose, several months ago, and they're not recommended or eligible at this point to get a second booster dose. What do you want to say to them? Some folks I think are feeling a little nervous as cases and hospitalizations rise. Is there anything on the horizon that would mean a recommendation for a second booster dose for people who are currently not eligible? Thanks so much.
Thanks so much. I will just jump in really quickly and turn it over to Michelle on especially this first question, and Dr. Lutz, you might want to answer the second question. Kate, the challenge that we've had on boosters, not just in Washington, but throughout the country, is that there have been disproportionate impacts to booster coverage compared to primary vaccines. As you can imagine, our African American communities, our Hispanic Latino communities, certainly our Pacific Islander communities, and even in some places, geographically speaking, we've had a drop off in boosters compared to primary vaccines. And I think that really just speaks to what we've been seeing, again, the phenomenon across the country, where we have really been doing everything we can to message to our community members the importance of boosters, the importance of ongoing protection. And unfortunately, that said, we've had also on the opposite, a lot of misinformation that has gone out there, and even frankly targeting many of these very communities with that misinformation that has made it very difficult for people to recognize the importance of boosters. So that is really what we have been seeing. There are some geographic differences. Obviously, in certain communities, including King County, we have more booster coverage than we do in other counties across the state. But again, this is the real challenge that we've had throughout this pandemic, is making sure people understand the importance of the protections and the tools that we have available for them. Michelle, anything you want to add to that? And then.
Yeah, I completely agree with everything Dr. Shaw said, and I wish there was one answer to this question, because that would be exactly where we could focus our efforts. But it really is multifaceted, and there's many reasons why different communities are getting vaccinated at different rates. I mean, I think systemic racism, access to healthcare, trust in government and healthcare decisions, COVID burnout, ongoing questions and concerns about vaccines, and needing to talk to a trusted partner and resource. And so I think some of those gaps, especially our gaps in race, ethnicity for the initial series, it took a lot of time, and we had to continue to build trust and do a lot of community specific events to help increase in vaccination rates on those populations initially and reduce the gaps. And that's exactly what we're working on right now for these gaps in booster doses. So it takes a lot of on the ground effort and a lot of work with a lot of partners and a lot of community-based organizations to continue to close those gaps, make sure people understand the importance. I do think there's probably some confusion as well to who should get a booster dose and when. As I just went through, there's a lot of different booster dose information. Different populations become eligible at different times. And that's why we're really, and there's different intervals depending on your age, your health, what vaccine you had as your primary series. So that's why we're working to do a lot of education and outreach to the public about, to healthcare providers too, to make sure they're recommending vaccines about what's right for you. So if anybody has questions, I encourage you to visit our website to get information, and anybody can call our hotline as well, 833-VAX-HELP, and get information that's specific to you, and that's in multiple different languages as well.
And Kate, thank you for the question. I guess a couple of comments for your consideration. Certainly, we know that the vaccine effectiveness decreases with time. And so certainly we've seen that the more times you get boosted, the better your immune response. And although we've seen the vaccine effectiveness decrease, we also know that the vaccines still have some effectiveness. If you find that yourself is one of those individuals who, again, you're not quite yet eligible for a booster, then I think I fall back in recommendations to what Lacey and I mentioned before. It really is looking at your own risk and acknowledging the risk that you find yourself in. If you're going to a gathering where, again, inside, high risk, then definitely, as Dr. Shah and Lacey both said, masking is definitely a strong recommendation. And then I also fall back on testing. So again, it's prevention, but then knowing that testing is available, and then falling back yet again on what I mentioned at my last point about if you do have COVID, that there are therapeutics available. And we know that these therapeutics are very effective at preventing severe disease.
Thank you, Dr. Lutz. Kate, would you like to ask any follow-up questions?
No, that's great. Thank you so much.
All right, thank you, Kate. Our next question comes from Kate Smith of the Yakima Herald. Kate, go ahead.
Hi, thank you for taking time this morning. Right now in the Yakima Valley, we're just starting to see an increase in cases. We're a few weeks behind Seattle and the West Side. At this point, how do you expect the current increase in cases and hospitalizations that we're seeing to progress throughout different areas of the state in coming weeks?
Thanks, Kate. I'll take that and I'll turn it over to Lacey, Dr. Lutz, if they want to add anything here. I think a lot of it is going to depend on our behaviors. We really have an opportunity to get ahead of this and prevent from what we're seeing across the country happening in our state. And while we're seeing increases in certain communities, particularly in Western Washington, we do recognize that, as we've seen throughout this pandemic, that none of us are immune to that transmission, that it's just a matter of time before it gets to other communities. And so if we take the protections, again, get our booster shot, we wear a mask, especially in those crowded, confined spaces without good ventilation, certainly when there's shared spaces, and especially if we are concerned about our own medical condition or because of age, that we're concerned about the frailty of our own condition or those around us, then that's where, it really is going to be up to us. And if we have symptoms and, we don't go out and expose others, rather we get tested and we stay home, we stay away from others, and we protect those around us, those are the ways that we're going to continue to be able to get ahead of this. And so what short of that, those individual activities and the collective continued reminder that we still have this pandemic ongoing, really it's a matter of spread happening, and it is hard to predict in which direction it will go. But I will tell you that you'll start to see increases in communities throughout Washington. None of us are immune to this. It's just a matter of the protections that we put in place. So Lacey, Dr. Lutz, anything the two of you would like to add?
Nothing for me. I think just to reiterate, what we see often on the West Side predates what we see on the East Side, but not always. And so I think we just have to be sensitive to the fact that, yes, cases are rising on the West Side. We're seeing them rise on the East Side, not to the same degree, but it really does come down to how much risk and the environments in which people find themselves. So masking is still a strong recommendation if you find yourself in an at-risk environment. And as we've talked about, being up to date with vaccines is just an essential piece to really prevent disease spread across the state.
Thank you, Dr. Lutz and Dr. Shaw. Kate, would you like to ask a follow-up question?
No, that was great. Thank you.
All right, thank you, Kate. Moving on, our next question is from Bolivar Choi of the CISC. Bolivar, go ahead. Oh, pardon me, it looks like Bolivar is not in the chat. He has submitted his question in advance. Bolivar would like to ask, for different COVID-19 testing, PCR, antigen tests, how long could an individual who has tested COVID-19 positive test positive again? Are the following statements correct? Is it for PCR, could it be up to 90 days? While for an antigen test, it's easier to show negative results after 10 days of isolation.
I'll go ahead and take that question. And I think those are nice round numbers for us to sort of remember. You know, PCRs, because they're a very sensitive test, can continue to pick up the virus for months, and we've seen that, but 90 days has been sort of the mark that we've been using for months. And then with respect to antigen tests, yeah, the majority of people are going to not test positive after 10 days, maybe even less than 6 days, but 10 days is a nice broad number. But do know that antigen tests can still test positive after 10 days. Theoretically, those individuals could still be contagious. And therefore, we tell people, based upon the CDC guidance, that if you have COVID, you are again in isolation for 10 days. You wear a well-fitted mask for days 6 through 10 if you are out of isolation. And if you decide to test positive, if you decide to test with an antigen test and the test positive, then consider yourself still to be theoretically contagious, and you should still be wearing a well-fitted mask in those situations where you're putting others at risk.
Nothing to add.
Thank you, Dr. Lutz. Our next question is from Elise Takahama from Seattle Times. Elise has also submitted her question in advance. What, if any, trends have epidemiologists identified in rising cases and hospitalizations? What age or demographic groups are being most affected now?
Yeah, I'll take a start with that, and then Dr. Lutz, if you want to add to this. You know, this is a time where we are seeing increases in many age categories, and a lot of that is really coming down to exposures. It's coming down to vaccination rates. We are seeing younger middle-aged individuals who are testing positive. Hospitalizations, it's a little bit variable. It very much depends on additional conditions that may be a reason that somebody is having a more severe outcome and being hospitalized. I think this is a good reminder to our providers and also to individuals in the community that if you test positive and you connect with your healthcare provider, you very much may be in the queue for Paxlovid antiviral medications, as we've mentioned, and that is something that should be started within 3 to 5 days of the onset of symptoms. And so we want to make sure that people recognize that this is an equal opportunity virus that continues to have people of all ages who are impacted, but those with particular medical conditions and age considerations are the ones that are having the more severe or serious complications or implications, if you will. Dr. Lutz, anything that I may have missed?
No, I don't believe so, Dr. Shaw. I think you captured it all. Thank you.
Thank you, Dr. Shaw.
Just really quickly, just so you know, I think Lacey's having some trouble on her Lacey, are you able to? You're good. Okay.
I think we've got it now. Yeah.
Okay.
Yep.
Perfect. Thanks.
Okay, and this concludes the question and answer segment of our briefing. We'll go to Secretary Shaw for closing remarks.
Yeah, I want to thank our team, Dr. Lutz, Lacey, Michelle, Andy for being on. I want to thank all of our partners that continue to help us through this difficult time. And I certainly want to thank our media partners that have remained with us throughout this pandemic. The reminder that we're seeing increases in cases and hospitalizations. This is the time to double down on remembering that the pandemic isn't over. And especially for those who are older, those seniors in our communities, as well as those with medical conditions, this is a time in particular to think about the protections to put in place. And we've talked about those, including vaccinations and boosters, certainly getting tested if you've been exposed, getting tested if you have symptoms, and most critically, also remembering that if you're in an indoor setting and you are in a confined, crowded place without good ventilation, not either or, any of those, that you really strongly should consider wearing a mask. And our recommendation is that we want to continue to get ahead of this, continue to fight the fight, and do everything we can to protect ourselves, each other, and our communities against COVID-19. And again, look forward to continuing to update our communities and all of you on what's happening in our state. I want to thank all of you for the incredible work that you've put in to help fight this pandemic in the state of Washington. And with that, I will turn it back. Thank you so much.
Thank you, Secretary Shaw. This concludes today's media briefing. I'd like to thank our panelists for their time today and TVW for hosting today's live stream and archives of past briefings. Thank you, everyone. Take care.